Good afternoon, everybody. I'm Dr. Carla Fry, and this is going to be my teaching demonstration for the nursing faculty candidacy. We're going to take a relatively complex subject, interpreting arterial blood gases, and we are going to distill that down into a very short presentation just to give you a little bit of an idea of my teaching style in the classroom. Now, looking at our objectives, by the conclusion of this presentation, it is my sincere hope that you can recognize normal and abnormal arterial blood gas values and distinguish those acidosis and alkalosis patients, as well as respiratory versus metabolic problems, using the ROMEO methodology, which I'm going to show you with some case studies. I also hope that you'll be able to analyze arterial blood gases, at least the simple ones, with minimal assistance. Now, just a little bit of an introduction. Of course, we all know that oxygen is essential for our health, for the health of our cells, organs, and tissues, and certainly for life itself. We also know that pH balance needs to be maintained within the body in order to prevent any complications. Now, some of those complications can be relatively simple, but others can be downright life-threatening, including such things as heart dysrhythmias and decreased neurostatus, where a person can become very, very confused and ultimately comatose. So it can be very, very serious. This is a complex system when you think about pH being regulated. Typically, the two major components will be the lungs and the kidneys. Now, if there's a body problem, the lungs work to try to resolve that, and they do so by either speeding up or slowing down the breathing. If indeed it is a lung problem, the kidneys work to regulate, and they do so by excreting or holding on to bicarbonate. And we won't get too far into that, but suffice it to say that this system regulated between the lungs and kidneys is a very fine and delicate balancing act, and when things get so far out of whack that they cannot be controlled, we can end up with some of those abnormalities that get life-threatening. Now, the way to really find out what's going on with our patient is through a simple blood test known as an arterial blood gas. This can be performed right at the bedside by either a respiratory therapist or by a nurse, and then those results are interpreted, and then treatment is going to be based upon those results so that we can get our patient back to a state of optimal health. Just quickly, the nurse will explain the procedure, perform the test, certainly obtain and interpret those results, and then notify the provider. Sometimes when the results come back very grossly abnormal, we need to really notify that provider quickly and initiate treatment that can be life-saving. Just to go over the normal values, there really are only 4 values that we're going to consider carefully. Now, there will be some other values listed on the arterial blood gas, but it distills down into just 4 major components that we are going to consider today. The first of which is the PaO2, or oxygen. That normal value is 80 to 100. Anything less than 80 is going to be considered not enough oxygen, and we term that as hypoxia. Well, the pH is next, and that is 7.35 to 7.45. With a pH of less than 7.35, we would say that our patient is in a state of acidosis. And if the pH is greater than 7.45, we say that they're in a state of alkalosis, or they're alkalotic. Next is the CO2, or the carbon dioxide. Now, everybody does have carbon dioxide, but in relatively low quantities in the body. If it's a little bit lower than 35, that's nothing to be too concerned about. When it does get over 45, though, not only can a person get into distress, but they can ultimately go into respiratory failure or just stop breathing altogether. So as the CO2 begins to climb, it gets more and more dangerous. And then last is the bicarbonate. This is a very, very important biochemical in the body, because what it really does is it helps to buffer or regulate that pH for us. So as we look to the abnormalities that we can find with our patients, there are 4, but we're really going to talk about 3 of them today. Respiratory acidosis probably being far and away the most common. Metabolic acidosis, also fairly common. And then metabolic alkalosis. Now, in each of these, you're going to see that there'll be some abnormals. With acidosis, respiratory acidosis, it's going to be a low pH and a high CO2. With metabolic acidosis, it's going to be a low pH and a low bicarbonate. And with metabolic alkalosis, a high pH and a high bicarbonate. So this is where the technique comes in. It's a really quick technique, super easy to do, even for a novice nurse. And so we like to teach this right away. They can recognize the most abnormal results and notify the provider quickly so that we can get our patient the treatment that they need. The technique is known as ROME or ROMEO, which stands for respiratory opposite and metabolic equal, and then oxygen is your O in ROMEO. We consider that one separately. So what we mean by respiratory opposites, we're going to use labels, little arrows beside each of the values, the pH, the CO2, and the bicarb. If the pH is low, it's going to get a downgoing arrow. If the pH is high, it's going to get an upgoing arrow, and so on and so forth. So we're going to consider again the pH, the CO2, and the bicarb. Each of them is going to get an arrow next to it, and then we're going to decide, is this a respiratory problem or is this a metabolic problem? We will then use the pH by itself to determine, are they acidotic or are they alkalotic? So are they respiratory acidosis, metabolic acidosis, etc.? I've found over the years that the very best way to really make this work is to do case studies. So we're going to just take 4 of them and run through them quickly. Ed is 33 years old. He presents to the emergency department and he's short of breath. He's got a fever and cold-like symptoms. When we look to his oxygen status, his PaO2, it's fine. He is not hypoxic. But if we were to put a downgoing or upgoing arrow next to the other values, the pH is slightly low, so the arrow would go down. The CO2 is slightly high, so the arrow would go up, and the bicarb is normal. In this case, considering ROME, we would look to having arrows pointing in the opposite direction with the pH low and the CO2 high, meaning this is a respiratory problem, and the pH is on the low side, so it is acidotic. So Ed is in respiratory acidosis. Next is Jim, 22 years old, admitted to the ICU with a gunshot wound. Now in Ed's case, when we look to his oxygen status, his PaO2 is also normal, so luckily no hypoxia. His pH is slightly high, so an arrow will be upgoing. His CO2 is normal, so no need to consider that. His bicarb is also slightly high, so the arrow would be pointing upward. In Jim's case, with no hypoxia present, if we use ROME, respiratory opposite metabolic equal, we have arrows pointing in the same direction. We would consider that to be metabolic equal. So Jim is in a state of metabolic alkalosis. Third, we have Wendy, who's 19 years old, and Wendy shows up with tachypnea, which is rapid breathing, and also a blood sugar that's very high at 350 milligrams per deciliter, should be about 80 to 100. In Wendy's case, she is also normal as far as her oxygen status goes, it's 90. But when we look to her pH, it is low, that's going to get a downgoing arrow. Her CO2, slightly on the low side, downgoing arrow, and the bicarb, very low, getting a downgoing arrow. This one's a little weird because you have 3 arrows instead of 2, all 3 pointing in the same direction, so that makes it a little easier for us. But if we did have any kind of a disparity there between arrows, we would look to the most abnormal value between the CO2 and the bicarb. But in this case, of course, the CO2 is not such a big deal as the bicarb. The bicarb is very low at 19. These arrows point in the same direction. Remember, metabolic being equal. So this is a metabolic acidosis. And then our last patient, George, 70 years old. This one's a little bit more complex because in George's case, you see that the pH has actually fallen slightly into the normal range of 7.35 to 7.45. His PaO2, or oxygen, is a little bit low, so we could say he's slightly hypoxic, but we're not so concerned about that. But as we take a look at this, and we're normally going to compare that pH to either the CO2 or the bicarb, we have a normal pH. So we kind of circle that for just a second. We'll come back to it. The CO2 is high. We would give that an upgoing arrow. And the bicarb is on the high side, and we would give that an upgoing arrow. So how do we compare this? Do we say that the pH is normal and just forget about it and compare the other 2 arrows? The answer is no. You always have to compare the pH to something. So what we would do in this instance is we'd remember our normal value for pH is 7.35 to 4.5, and we think, does this pH look closer to abnormal on the low side or closer to abnormal on the high side? In this case, pretty short time ago, probably maybe an hour or less, George was actually probably in a state where his pH was low or acidotic. So we're going to give that pH a downgoing arrow, and we're going to compare those arrows to one another just like we have in the past. We'll in this case say that we have respiratory opposite with a pH with a downgoing arrow and a CO2 with an upgoing arrow. And this makes sense because we've got a guy who's got respiratory distress, flu-like symptoms, and so it really does fit the picture. George is in respiratory acidosis, but instead of just calling it respiratory acidosis, because the pH has normalized, we would say it is compensated respiratory acidosis. Well, that one again is a little bit tricky, but just to give you an idea of how we might handle something that falls slightly out of the norm, and hopefully that will help you a little bit with your understanding. This concludes my presentation. If you have any questions at all, please don't hesitate to reach out. I hope you've enjoyed the presentation. I hope you've learned a little bit of something today, and enjoy the rest of your afternoon.